Can you hear me?
Yes, sir. Yes, sir. Sound is sir.
Okay, okay. Okay, can I start? Okay. Thank you. Thank you, dear friends. And now, good evening, good afternoon, my dear friends. And today we are here with a webinar in a very important topic. I should say it's a very important topic. Simply we say anorexia. Anorexia in dogs and cats. When we look at the issue, it may be a very small issue. But in our clinic, almost all the clinical cases are presented with this clinical sign. What can we do? See, it's a big question, especially when simply anorexia only is presented. Maybe having anorexia only, no other clinical signs. So in such conditions, what we can do is we can just go for symptomatic therapy and wait for the clinical signs to arise. That's all we can do. So sometimes it becomes a very puzzling question. So now in this webinar, we are going to analyze which are the possible causes of anorexia. When we think about the causes of anorexia, we can just think of only the possible causes of anorexia and not all the causes. We cannot detect all the causes of anorexia. That is true. Because I've already mentioned anorexia of unknown origin. This is a very common clinical sign which is being presented to our clinic. So let us explore which are the possible causes of anorexia. We all know the meaning of anorexia. Anorexia means no hunger, not eating anything. Okay. So before going through the true uh, technicalities of diagnosis and various studying of anorexia, we have to know, we have to get along with some technical terms which we very commonly use in diagnosis of the causes of anorexia. First is appetite. What is appetite? Appetite is a very common colloquial term which is used in human beings. Oh, I don't have any appetite. I have good appetite. It is sometimes used as a wrong technical term in human beings. Appetite is actually a psychological stimulation which is seen in human beings and animals generally. When I think of, oh, jalebi, sweet jalebi, fantastic jalebi, delicious jalebi. Okay, immediately I will have that salivation. Sometimes I may swallow some saliva, and immediately what happens to my body? All my secretions inside my mouth increases. Just thinking of the jalebi, thinking of imagining the picture of jalebi inside my mind. And what happens? All the salivary amylase, the pepsin, everything will be released. The renin, all these things will be released. All these are digestive enzymes. Why it is released? It is actually preparing the mouth to accept the bolus of jalebi. Okay, then secretions from the pharynx also will increase. It is just to give the lubrication for the jalebi to go inside. Oh, immediately the brain sends all the messages. Come on, let us be ready. Jalebi is coming. Oh, my dear, jalebi is coming. Let us be ready. And everything gets ready. Then immediately the secretions from the stomach also slightly get increased. That is, the stomach is preparing to digest it by production of gastric juice. So body as such will be preparing to accept or to eat the jalebi. So this type of a psychological evenful things which are happening inside the body is known as the appetite. It is appetite. It is a desire for the food. I think of jalebi. Sometimes I think of chicken fry, or even not thinking. Sometimes seeing it, somebody is biting and crushing, pulling and tearing the chicken fry. You'll have the desire to eat it. Chicken fry. Oh, how tasty it is. Immediately, you will get that sensation. Saliva will come inside. So that is appetite. And also, this preparation, as it is appetite, this preparation alters with the pH also. For example, somebody is eating raw tamarind. Somebody is squeezing and eating a piece of lemon. We know lemon contains citric acid. Tamarind contains tartaric acid. We know very well. These are all organic acids. If acids are going inside, immediately there should be some saliva to antagonize the effect of these acids. That is, alkali-rich saliva will be produced, such a bicarbonate-rich saliva. The same thing that is happening in dogs also. See, thinking of all these things, I'm also getting that appetite. So, the same is what is happening in alkalis also. So, that is appetite. It is a desire for food which is psychological in nature, purely psychological. The same thing is applicable in dogs and cats also. We know the father of psychology, Ivan Pavlov, who conducted his bell ring experiment in dogs. So when he put the dog inside the cage and he put the most delicious food for the dog outside and he locked the cage. So dog, he was very hungry, appetite increased, the desire for that delicious food increased. He started salivating. So that is appetite, psychological desire for food. But what is hunger? Hunger is a little bit different. As appetite is a psychological issue, hunger is a physiological demand. It is a physiological demand. Hunger will not come always. Hunger will come only in time. Some people may be telling, oh, now what is the time? Oh, it is 3 o'clock. Now it is time for me to have the lunch. Some people will get the hunger only in specific times. It is a physiological need. By that time, everything will go down, like the lipid, plasma lipids, the plasma sugar, the plasma amino acids, everything will go down, and their sensation of hunger or the stimulation of hunger, there is a hunger center or an appetite center. This thing will be stimulated by lowering, or there are so many factors, and the hunger will be stimulated. Some people may tell you, oh, there is something, there is barbaric me, flatulence, everything inside the stomach. Eh? During that time, this is real hunger. And during hunger, he should have something. He cannot escape from that. He should, or the dog should eat something. So that depends upon the specific timings and constant preparation of the body, which has been practiced throughout years or months. So that is hunger. That's an excessive desire for the food. I think you got the point. What is hunger? Then the third technical term is satiety. Satiety means I have eaten a lot. I had hunger. First, I had that appetite. Then I had that hunger. I ate a lot. After eating, my tummy is getting full. Okay, the tummy has got full. And now what happens? Somehow at a point, I have to stop eating. Otherwise, I will go on eating. My tummy will become big. And if you constantly eat, if the dog constantly eat too much of food, there will be a gastric dilatation, mechanical dilatation of the stomach. And there will be stretching of the wall of the stomach, making the wall of the stomach so thin. So in order to that, or in order to prevent that much of filling of the stomach will be filled, and at a point, another center, brain center, will depress this hunger center, and we will stop eating. That is opposite to the hunger and sensation fulfilling the hunger. The sensation which is fulfilling the hunger, that is satiety. तो ठीक है, bus finished. Oh, tummy is full. I don't want anything for no. You please drink this glass of juice also. No, I don't have any space inside. I stopped everything. Please don't give me your thing. My tummy is full. I cannot even drink a sip of water. No, okay, that is satiety. Got it? That is satiety. Now, our real technical term is coming. What is it? It is anorexia. The technical term anorexia. Anorexia. Orexia means hunger. It is another term of hunger. Orexia means hunger. Sometimes orexia is used for appetite also. So generally orexia means hunger. Anorexia, no hunger at all. Anorexia. Okay. Then see, anorexia is the common complaint of our pet parents. Anorexia. So let us see what is hyporexia. Hypo, we know hypo is low, hyper is high. You know what is hyperorexia? No, we have to think about hyporexia. Hyporexia. Hyporexia means it is decrease in the appetite. Decrease in the appetite because there is no much stimulation due to several factors. We are going to study all these things. Due to several factors, the animal has a decreased appetite. Maybe physiological, maybe psychological, maybe neurological. We do not know what it is, but it is hyporexia. That is hyporexia. Then what is inappetence? Actually, this inappetence is hyporexia itself. But there is a slight difference. Like hyporexia means it is a little bit decrease in the appetite. Little bit decrease in the appetite. Anorexia means totally appetite is lost. Little bit decrease is known as hyporexia. When there is a partial loss, that is why when there is a partial loss of appetite, or when there is a reduced diet intake, we should not say feed intake in dog. There is no feed in the dog. As I said, when small animals are considered, some higher technical terms are used because they are the VIPs in certain houses. That is why it is not the feed of the dog. We cannot say the feed intake in the dog. It is a diet intake in the dog. It's a diet intake, not feed intake. It is not feed. It is only food. As just like in human beings. It's like the food intake in dogs or diet intake in the dog. Just like the human beings. Okay, so when there is a reduced diet intake, it is known as inappetence. Or when there is a partial loss of appetite, we say it is inappetence. So the technical term, the literal meaning is inappetence, no appetite at all. But really it means that there is a partial loss of appetite. But this hyporexia and inappetence are almost the same. You are not wrong if you are using hyporexia in place of inappetence or inappetence in place of hyporexia. You can use it. Nobody will disturb you. You can use it. Nobody will beat you. Nobody will punish you. Then the third one, what is oligorexia? We know hyper, we know poly. All these things are increased. So oligorexia means the dog or the cat is eating only little food. Yesterday or day before yesterday, he was eating the normal quantity of diet. But now it is eating only little food. The volume of the food which it normally eats has become less. That is oligorexia, reduced eating. Got it? Then we know about polyphagia, or it is opposite to oligophagia or oligorexia. Polyphagia means increased appetite. It will eat more food. That is polyphagia. We know very well. Polyphagia is always pathological. We know the conditions where polyphagia occurs. Polyphagia occurs in chronic pancreatic disorders. Polyphagia occurs in hyperactive gut flora diseases. Polyphagia occurs in diabetes mellitus. Polyphagia occurs in Cushing syndrome. So, polyphagia is just opposite to anorexia. Dysphagia. Phagus means eating. Dysphagia means difficulty. It is not difficulty in eating, but difficulty in deglutition. Deglutition, that is difficulty in swallowing. That is dysphagia. Dysphagia. A very difficulty, much difficulty in swallowing the bolus of food. Can be due to different factors inside the pharynx, the oropharynx. Maybe a tumor inside the oropharynx, maybe some painful ulcers in the oropharynx, But if it is due to painful reasons, severe pain, too much, it is having good appetite and hunger, it is it is too having too much of pain inside the oropharynx, so that as when food is going through the oropharynx, it is showing too much of pain. If this condition is known as a painful swallowing or odynophagia, painful deglutition or odynophagia. So odynophagia occur in human beings as well as in dogs and cats. But in human beings, as we people are very greedy to food, we cannot adjust without food. We cannot adjust our day without chicken fry. I'm a non-vegetarian, that is why I'm always mentioning about chicken fry. So vegetarians, they cannot adjust without paneer fry. They cannot adjust without lassi. Okay, let us take solid foods. You're eating chicken fry or paneer fry, but we are having lot of ulcers inside the throat or severe pharyngitis, sore throat. We say sore throat. It will be too much difficult for swallowing it, but we need the food. So adjusting with all the pain, we will swallow it, even though we have good pain. But animals will not be like that. If they are having a sore throat, they will go to the food. They have good appetite and hunger. They will smell the food for some time, and they will slightly nod the head and go back, run away. They will not nod the head, but we can feel that they are nodding the head and running back, because they know that they cannot swallow it, or they cannot prehend it. They cannot prehend it, or they cannot sometimes chew it. Animals literally do not chew, but something, when they are taking some bone inside, they will break it up. That is chewing. Because we the humans have flat teeth. That's for grinding and chewing. But dogs, they do not have a flat teeth. They do not have a flat teeth and they cannot chew. So that is odynophagia, painful deglutition or painful swallowing. Then coprophagia. Coprophagia, definitely, no, it is not seen in human beings. We all know what is coprophagia. Coprophagia means, copro means stool. Coprophagia, eating stool. Either the dog is eating its own stool or it is eating the stool of other dogs. That is coprophagia. So coprophagia is a big abnormality. There could be some intestinal issues. Only GI issues will produce coprophagia. You know very well. Yeah, we have been dealing with the coprophagia for so many years and we know very well about coprophagia. So in coprophagia, it will be eating its own stool or the stool of other dogs. So that is coprophagia. So we know coprophagia, the problems which end in coprophagia, such as heavy intestinal parasitism, certain deficiency diseases such as iodine, iron, copper, cobalt, magnesium, trace elements such as magnesium, then sometimes pantothenic acid deficiency, biotin deficiency. All these can lead to coprophagia, mainly the mineral elements or the trace mineral elements. So we know very well how to deal with coprophagia. What is the best medicine for against coprophagia? We know very well. We have a lot of medications in the field. But the best medicine I have ever found is simply give papaya. Papaya. Simply give papaya. Either raw or ripened. Okay, that is coprophagia. Then the next technical term we have to study is allotriophagia. Allotriophagia. Allotri, it is written as allotrophagia. No, it is there is a spelling mistake there. It is my mistake. Allotriophagia. Allotriophagia means it is not eating food, but eating other than any other things other than food. It will be having a depraved appetite. So it will be eating anything other than food, but not food. That is allotriophagia. It's also very commonly seen in phosphorus deficiency, iodine deficiency, iron deficiency, etc. Allotriophagia. Eating non-food substances. Geophagia, we very well know. Geophagia. Geo means mud or earth. But the dog cannot go and eat the earth. But what the earth means, it is meant for the mud, eating mud. Generally, our patients as the dogs have an affinity towards mud or earth or the soil. Sometimes they eat it due to that affinity. Whatever you give, whatever the treatment you give, it will not stop mud eating. Especially this is seen in young ones, geophagia. The next one is regarding a concomitant issue, that is oligodipsia. Oligo means less. Dipsia means drinking of water. Drinking. So less drinking of water, that is reduced drinking, that is oligodipsia. We know it. Then we have a polydipsia. We know very well what is polydipsia. Increased thirst or increased drinking of water. So oligodipsia, okay, that happens along with anorexia. But polydipsia is a disease. It's a symptom of a disease. We know when there is high level of sugar in the blood, such as in diabetes mellitus, Cushing syndrome, etc. Polydipsia occurs. Then, in increased frequency of urination, such as in diabetes insipidus, there will be polydipsia, more drinking of water. So, next we are coming to the food. So now we have studied the technical terms which are commonly used in anorexia. How food intake is being regulated. Food intake in animals is being regulated by certain mechanisms. Factors are there which regulate the food intake. The factors may be coming inside the body or from outside the body. That is internal factors or external factors. Food intake is regulated means the volume of food intake, frequency of food intake. Sometimes the dog eats only little food. There is oligorexia. Sometimes it has to be given. Usually we offer 5 times a day, 4 times a day, but he is eating only once a day. Again, that comes under oligorexia. So thereby the food intake is regulated or decreased, or the food intake is increased. So food intake is regulated, or we generally speak it is decreased or increased due to certain intrinsic or extrinsic factors, or internal or external factors. So the internal factors can be a central factor or a peripheral factor. Central factor means those factors which arise from the brain. Peripheral factors means those factors which are arising from some target organs, maybe the tubular organs, maybe the alimentary canal, from the mouth to the anus, or from other tubular organs like the uterus or the ureters, urethra, bladder. So these are peripheral factors of internal factors. Let us speak something main about the internal factors. The internal factors include mechanical stimulation of the GI tract. How food is being regulated? Mechanical stimulation of the GI tract. So voluminous food is going inside and the intestinal wall is stretched. So immediately the mechanism will tell the satiety center that stop, up to enough. In Arabic language they say khalas. So see, I am telling a single word in Arabic because I worked in Saudi Arabia previously for some time. So excess food intake will definitely produce a satiety effect and it will stop eating. Thereby the regulation of food intake is controlled. Food intake is being controlled. So that is a mechanical stimulation of the GI tract. Then it will be increased. Some appetite will be increased due to hormonal responses, which is sensitive to sight of the food. Which is sensitive to smell of the food. Oh, smell of the sight of the food means their delicious diet is there. At their sight, it will be regulated. So sometimes delicious food may be there, sometimes not delicious food may be there. If not delicious food is there, which is not delicious for that dog, there will be a regulation of food intake. Why? They will eat only less because it is not delicious too much. But somehow it is regulated, it is highly palatable, it is highly delicious. For example, when I am coming, if I am the subject, consider I am a dog, in front of me, snake guard fry is being prepared. My wife prepares snake guard fry or ladies finger fry. These two things I hate the most. I don't like ladies finger, I don't like snake guard. My wife is preparing this. So what I will do, out of hunger, I will eat some little bit, but I will tell no. I eat only because of my constraint. That she says she prepared only ladies finger fry and snake guard fry. And what I do, I have only this thing. And what I can do, I can eat only this thing. And so I eat only less. I am forced to eat this thing, only less food intake. And so what happens? That is a regulation of food intake. And so hormonal responses such as sight, smell, and ingestion of food. Certain foods, when ingested, when it is less palatable, that also regulates the food intake. Okay, that also regulates the food intake. And then some other internal factors. Body stores of fat and glycogen. When the body stores of fat and glycogen are more, there will be less diet intake or food intake. That thereby it is being regulated. The food intake is being regulated. Then certain gonadal hormones. Increased gonadal hormones will always increase the appetite. Why? Because gonadal hormones are necessary for the muscle development, body development, genitalia development, etc. Gonadal hormones such as testosterone and estrogen are necessary. So what happens is that they will, the increased presence of these gonadal hormones will increase the appetite to eat more food. So these are some of the internal factors, and we can go to the external factors. External factors which regulate food intake, such as the environment, temperature, etc. Changes in environment definitely will change the volume of food consumed. Change in temperature. We know in cold places, people eat more food. Why? Because it is very cold. The ambient temperature is so cool. In order to generate more body heat, they have to eat more. So also in our climates also, when it goes to the rainy season or when it goes to the cold season, we eat more. When it goes to hot seasons, we eat less because less amount of metabolic heat should be produced so that the temperature of the body is being regulated. Otherwise, if we eat more food during temperate or hot seasons, more metabolic heat will be produced. It will definitely hurt the body. Okay. Now we are going to food intake. How it is eating the food or the food intake, coming to the food and then eating and then stopping. That takes the whole food intake. The food intake is divided into two phases. The first phase is initiation of feeding followed by eating. Initiation of feeding followed by eating. That means a small slight appetite is there, it is coming to the food and it is eating. Or a good appetite is there, it is coming to the food and then eating. Then the second stage or the second phase is it has to be stopped. Termination of feeding by stopping eating. These are the two phases of food intake. One is eating the food, literally speaking, eating the food and stopping the food. That's all. That are the two phases of food intake. Food intake is being regulated and food stopping is also being regulated by a center, hypothalamus, in the brain. This hypothalamus is located ventral to, see, this is the third ventricle. This is a corpus callosum. This is a third ventricle space. And this is the medulla. And you can see this red rounded area. This area, this is the area of hypothalamus, nuclei of hypothalamus, the area of nuclei of the hypothalamus. And this is the pituitary, that is hypophysis. So ventral to the hypothalamus is the hypophysis. This is a real picture of the brain. You can see the area of hypothalamus is not a clear-cut organ. If you dissect the brain, you cannot see the hypothalamus. You can only see the area of hypothalamus. It is another, see, this is a clear schematic representation. That was a photograph. Here you can see the schematic representation. This yellow area, which is well demarcated, is the area of hypothalamus. And you can see the two pituitary glands. So hypothalamus, beneath that is a hypophysis or the pituitary. So this hypothalamus is lodging the area of appetite center as well as the satiety center. Appetite center means for stimulation of the appetite. Satiety center means it is for the cutting off, stopping the appetite. This is another schematic representation. Here also you can see the hypothalamus, the hypothalamic, the pons, the medulla oblongata and the pons, and this is the pons, the spinal cord, and you can see the cerebellum, so cerebrum, there is the biggest cerebrum, and you can see the hypothalamic area. This is the area of hypothalamus. And beneath that, you can see the hypophysis, that is a pituitary. And when you take the cross section of the hypothalamus, when you take the cross section of the hypothalamus, this we have to just keep in mind. When you take the cross section of the hypothalamus, you can see this is the dorsal area and this is the ventral area. And so this is the lateral area. These two are the lateral areas. Lateral areas, dorsal area and ventral area. And this is the area of the hunger center. And this is the red one is the area of the satiety center. So this is the ventrolateral aspect. In the ventrolateral aspect is the area of the hunger center or the appetite center, and the ventromedial area is the area of the satiety center, which is antagonistic. Both the centers are antagonistic in nature. Just to keep in mind, because we are never going to dissect out and see all these centers in our lifetime. Just keep in mind. So we have already mentioned that there are two phases of feeding. So we have the first phase, that is eating, and second phase, stop eating. So we can go to the first phase of feeding. Coming to the first phase of feeding, it starts from the appetite center. The appetite center is located in the ventrolateral aspect of the hypothalamus. Ventrolateral aspects we have seen in the picture. And the satiety center is situated in the ventromedial aspect. Ventrolateral and ventromedial. And during the first phase of feeding, there will be a physiological stimulation in the hypothalamic appetite center. Naturally, it should occur. That can be triggered by so many reasons. Then only this appetite will come. Somebody should go and stimulate the appetite center. Maybe the sight of food, maybe the smell of food, maybe the thinking of food, or coming to the mechanism of action, alpha adrenergic stimulations, alpha adrenergic mechanisms. We know the adrenergic mechanisms by which there is stimulation of the sympathetic system. During the stimulation of sympathetic system, we have the adrenergic response. And during this response, we have the stimulated appetite center. So adrenergic stimulations can produce stimulation of the appetite center, and with alpha adrenergic stimulation, see, alpha adrenergic stimulation can cause, for example, epinephrine, norepinephrine, etc. can stimulate the alpha adrenergic receptors of the appetite center, producing appetite. So these are sometimes we can say as chemical mediators, and this appetite center can be inhibited by certain chemical mediators like beta adrenergic chemicals. Beta adrenergic chemicals include drugs like clenbuterol, terbutaline, salbutamol, etc. Or even dopaminergic drugs can suppress appetite. Dopaminergic drugs can suppress the appetite center. For example of dopaminergic drugs like our well-known cabergoline tablet, bromocriptine. Cabergoline is well used in our day-to-day use, where we use this to induce heat, to terminate pseudo-pregnancy, all these things. Then that was regarding stimulation of the appetite center. And another thing is that when the satiety center is stimulated, that itself will directly inhibit the activity of appetite center. Satiety center directly inhibits the activity of appetite center. We know that the appetite center and the satiety center are antagonistic in nature. So feeding is initiated by reduction in negative signals from the satiety center to appetite center. Yes, from the satiety center, if more signals are given, it will depress the appetite center. So when the negative signals of the signals of the satiety center are reduced, it will be stimulated. Appetite center will be stimulated. It will start eating. As when the tummy is getting full and full and full, what will happen? Lot of or more of negative impulses or signals will be transmitted from the satiety center to the appetite center, and so the appetite center will be depressed and the animal stops eating. Okay. Another thing is that if there are certain lesions which destroy the appetite center, they also will lead to progressive anorexia, and consequently there will be weight loss. Progressive anorexia and weight loss. So that was regarding the first phase of feeding, that is intake of food. Then the second phase, after intake of food, everything has to be stopped. Everything has to be depressed. So then the second phase of feeding comes. That is termination of feeding. Regarding termination of feeding, as I said earlier, there will be increased activity of satiety center. There will be increased activity of satiety center. And any lesion in this center, what will happen if this satiety center is destroyed? due to a tumor or canine distemper, what will happen? There will not be any inhibition of feeding, so that there will be a voracious appetite. A voracious appetite. And this inhibitory center, known as a satiatory center, it will be always receiving pre-absorptive and post-absorptive inputs. So it will receive inputs from the pre-absorptive and the post-absorptive receptors. Simply just think of it, what is a pre-absorptive and the post-absorptive receptors? These are certain receptors fixed onto certain organs which will respond to stimulus of food. Pre-absorptive receptors are located in the oropharynx, stomach and intestines. So when inside the mucosa of the intestine, stomach, oropharynx, etc., pre-absorptive receptors are there. So when food is being taken or a sight and smell of food is there, copious secretion is there, immediately this will be transferred to the appetite center, so that the appetite center is stimulated and it will have food. As when food is being eaten, it will reach the oropharynx, it will stimulate again the pre-absorptive receptors there, again it will be stimulated until there is stretching of that area, especially inside the stomach and intestine. When it is stretched too much due to enough quantity of food inside, this will be taken up as an input by the post-absorptive receptors, and the post-absorptive receptors will transmit the signals to the satiety center, stimulating the satiety center to stop food intake. Okay, that is so simple. Pre-absorptive and post-absorptive receptors in the alimentary canal. Some mechanoreceptors. Mechanoreceptors will definitely respond to gastric filling. Yeah, when there is a gastric filling, there will be stretching of the gastric wall. And so this stretching I'm sorry, for a second I lost the connection. Now it is okay. And the post-absorptive signals, when post-absorptive signals are thought to arise from, post-absorptive signals are not simply it is there, it is thought to be arised from alterations of glucose metabolism in the liver. When there is alteration of the glucose metabolism, a post-absorptive receptor stimulation will be going to the satiety center, producing stop eating. When there is meal-induced blood insulin concentrations, insulin will come out only when there is a carbohydrate-rich meal. So when there is meal-induced insulin output, insulin release, when the insulin is high, okay, immediately that message will be passed to the satiety center, stop food. Then the insulin glucagon ratio, of course. Then the changes in amino acid balance after food intake. Not only the carbohydrate. When protein rich food are eaten, when the protein is split up into amino acids and then absorbed, the high amino acid level of the blood will also give a stimulation through the post-absorptive receptors to the satiety center to stop feeding. Okay. There are certain factors which regulate the diet intake. We know some things like this. Pain. When there is pain in the animal, they will not eat much. Sometimes they will totally refuse food. Stress, especially in the cat. Stress of any cause. Maybe due to stress from the environment, stress on the sight of strangers, when they are changing the food, when they are changing the environment, like when we are changing the cage, etc., can regulate diet intake. Thereby, the diet intake is reduced. Or alteration in the normal routine activities of the dog. The dog is taken out at 3 o'clock. It is not being taken there, where it was continuously taken out by the master for 4 years. Now, the master is dead. He is no more. Nobody is there to take him out. It will definitely affect the diet intake of the dog. The immediate surroundings. For the last 4 years, it was in a surrounding, it has a kennel, it had a kennel, but now it has been sold to somebody. And it is a new kennel. Surroundings are changed. New surroundings have come. There will be definitely a reduction in diet intake. Then high calorie diet always promotes hunger. And low calorie diet always depresses the hunger by stimulating the satiety center. Alterations in taste and smell of food. Of course, we know. The dog is eating daily a regular food. Yesterday, the old cook, he made a quarrel with the master and he went off. And now there is a new cook who has come today for preparing the food for the dogs. He is preparing the food according to his practice. But the dog immediately senses that the slight alteration in the taste and smell of the food, either he will reduce his diet intake or he will not take it at all. Alteration in taste and smell sensation of the animal. Sometimes the animal, due to some diseases, may not be able to smell or taste the food well due to rhinitis, due to rhinotracheitis or laryngorhinitis. The animal is not able to smell it because the smell sensation will be lost. It is the olfactory organ is not working, the nasal mucosa is not working, so it cannot smell it well. Smell is lost, so appetite will be depressed. Taste is gone. So all these things can happen. It will depress the diet intake. Actually, it is a beneficiary mechanism. Why there is low diet intake in the disease, in any disease? Suppose there is gastritis. It won't eat anything. Why? Because the body is acting in such a way that the alimentary canal is given complete rest so that it is healed. It's a natural body mechanism. See, consider wild animals. It is having anorexia. Who is there to treat it? There are no veterinary hospitals or veterinary doctors inside the forest. There is nobody to treat it. So what will happen? It will go take rest for 2 days, not eating anything. After 2 days, it will become okay. That's a nature's mechanism. That's what naturopathy people tells. But we cannot adopt this technique because our client is too calculative and very sensitive. He may eat, he may not eat, but he will not allow his pet to starve. So also basal metabolic rate is a factor. If the basal metabolic rate is high, and if the basal metabolic rate is altered or low, the diet intake is changed. Then the body temperature. Animal stops eating when it is having fever because food intake itself will increase the basal metabolic rate so that the body will depress the appetite center and regulates the diet intake so that there is no increase in body temperature according to what they eat. Plasma concentrations of glucose and amino acids. When it is more, the stimulation is going into the brain, stimulating the satiety center so that appetite is decreased. Then, when the CNS concentration of neurotransmitters such as serotonin and the precursor of serotonin, that is tryptophan, it is altered. So also the amount of food intake is also altered. Insulin, high amount of insulin will depress the satiety, will depress the appetite center. High amount of glucagon will stimulate the appetite center. Growth hormone will increase the appetite center because for the action of the growth hormone, they have to get more calories. Thyroid hormone will increase the metabolic rate by increasing the appetite. Estrogen will increase the appetite. Gut peptides released during feeding, such as cytokinin, cholecystokinin, can stimulate the depressant center like the satiety center. There is a classification of anorexia. Like the broadest classification is, it may be due to the classification. Anorexia can be due to physiological, psychological, or pathological. But we can classify according to the causes as primary anorexia and secondary anorexia. I am coming into my experiences also. So let us broadly classify anorexia into primary anorexia and secondary anorexia. Let us go to primary anorexia. So it is occurring directly from the abnormal effects in the body of the animal. Directly from the body. It is not from the outside or other diseases. Directly from the body, like stress due to change in home. Of course, it is substantiated. When there is a change in their house, anorexia occurs due to stress. New environment. When the animal is sold to somebody, this is highly applicable in the cat. When there is sudden change in palatability of the diet, Animals are highly sensitive to this. Immediately, an anorexia develops, a primary anorexia. When there is an alteration in daily routine, such as the master of the dog, he is taking him out at 3 o'clock every day. So by 3 o'clock, even though he doesn't know how to look the clock, by 3 o'clock, he'll be literally ready to go out. But the master die on a day. What will happen? From that day, he cannot go out. He senses it. Why this? Where is this fellow? He has not come here to take me. So that stress will come. And he will have anorexia during that time. That is alteration in the daily routine. Fear. During fear, no animal or no human being will take food. Anxiety. Fear and anxiety are brothers. During anxiety, no animals will take food. It is for us also. If we have anxiety, there will be reduced food. Suppose we are having a very big debt of 10 lakh rupees in the bank, and the bank has sent us a memo stating that before 15th of July, we have to remit the 10 lakh rupees. Otherwise, they will move for legal proceedings. They say like that. We are in stress. We are in stress because we are anxious. We are having that anxiety. We are anxious because we don't have money. We are highly anxious. Don't know what to do. See, by before 15th, we have to pay 10 lakh rupees. I don't know what to do. We are in stress and anxiety. And we, due to the anxiety, chemical mediators will be released. It will be stimulating the appetite center, stimulating the satiety center and producing anorexia. So that is anxiety, fear, excitement. When the animal is too much excited, as when, for example, it is having the presence of an old person, it was his old master. It will have a transient excitement, and due to that, it won't take any food. Other excitement is sexual excitement. We have a male Labrador in our house. Somebody is having. And this Labrador will become too much excited when the local mongrels, females are in heat. It will become always alert like this. It won't eat anything. For even 1 week, it won't eat anything. It will be always alert because of the sexual urge, the sexual excitement. It won't eat anything. So that is excitement. Then severe pain, of course, we know when there is severe pain, severe abdominal pain or limb pain, whatever it be, it won't take any food. Male dogs, when bitches come into heat, yes. So these are all things which are arising directly or which is hitting directly to the body of the dog, body of the animal. Hitting directly. See, in humans, anorexia nervosa is there. Anorexia nervosa, to a certain extent, is there in animals also. But the type of anorexia nervosa is different. Anorexia nervosa in human beings may be due to a big debt in the bank or a threat of those people who has given money in blade interest. So threat of those people, threat of a transfer, no sleep, no food, nothing, always threat of a transfer in government offices, whom to approach. See, all these things produces anorexia nervosa in human beings. But literally speaking, I don't have any anorexia nervosa at all. Whatever be it, if I'm going to be chopped, then also I always tell my wife, I'm going to be chopped. Even in that condition also, I will eat. So such people are also there. If I am sentenced to death, tomorrow morning at 5 o'clock, I will be hanged inside the jail. Okay, that is it. Up to 3 o'clock, we can sleep. It is allowed. We will sleep up to 3 o'clock. Okay, it is there. Think positively. Up to 3 o'clock, we can sleep. Sleep well. Killing is only by 5 o'clock. So that is anorexia nervosa. But the cause of anorexia nervosa in animals is entirely different. They do not have a bank debt. They do not have blade interest people. They do not have transfer, nothing of that sort. But they will have anorexia nervosa according to their food, environment, kennel, cattery, master. All these things produces stress and anorexia nervosa. Or sometimes when the master is away, it will have that stress. It will have that anorexia nervosa. When the master is away or animal is away from the master. During 2001, I was staying with my family where one of my friend, he asked me whether I can bear his pet. It's a dog. It's a female one. Very naturally, a very healthy one. I said, of course, I can look after. He came with the pet, but the pet was reluctant to leave him because this gentleman, he has so many pets. At any cost, he wanted to get rid of one pet. And literally, I was adopting this pet. But you know, this pet is too much attached to this gentleman. And that was a lady. My wife actually saw this incident. And after coming to my house, he refused all the food. He was absolutely inactive. He was there in my veranda. He was there. He did not take any food at all. Always looking dull and depressed. Only because of anorexia nervosa and stress. Because he is away from the master. The first day, I gave all the food, different foods. He didn't even touch. He refused water. And the next day morning, I gave food and water, new food and water. He refused totally. The noon again I offered. He refused totally because it is new environment. His master is not there. He having anorexia nervosa and stress. He refused. In the evening also, he refused totally food and water. I know that it was anorexia nervosa. Tried to feed, and being a doctor, I thought of giving some IV antibiotic, IV fluids. But he was growling at me. He didn't even allow me to come near him. At last, you know, in that the second day evening, I called upon the original master and she came in the auto rickshaw. I said, you take him because he is not eating anything. I cannot handle him. He is not eating anything. That is a big problem. He is not drinking anything at all. Now other people, my neighbors also were there. They all told the same thing. Call him back. I called her. He came back in an auto rickshaw with her daughter. Literally, the thing happened was that by night, she and her daughter came in an auto rickshaw. It was dark. In the dark, the auto rickshaw was stopped and they came out uttering the name of that dog, that pet. Immediately, that it was dull and depressed by that time. Immediately, by listening to the voice of his master, immediately stood up. He became alert, started barking, bow, bow, started barking, became too very active. Then they came in front from the dark, walking. They were walking towards him. Immediately he noticed them. What the type of excitement he was showing, My wife was witnessing all these things. Everyone wept, even myself, my eyes were wet. All the neighbors, everybody were weeping. And this lady and her daughter, they were also weeping like anything. They hugged, and the dog also hugged them. In front of us, they offered the food, and he ate and drank everything they offered. This is the type of anorexia nervosa which is expressed by animals. The same thing happens in cows, wild animals, even sometimes in snakes. Then another cause for primary anorexia is the sight of predators. Predators are there, maybe hunters, maybe other wild animals such as lions, tigers, etc. So when there is a sight of predators, they'll be too afraid and they will go anorectic, because all the time they will be alert, looking hither and thither, because they are frightened. Know that predators are somewhere there. It is a natural instinct given by the God. So these are the main causes of primary anorexia. Let us go to secondary anorexia. You see, we have studied dermatology, the primary skin diseases and secondary skin diseases. Primary skin diseases are those skin diseases produced by the primary invasive organism directly hitting the skin, such as the bacteria, fungus, yeast, parasite, etc. Whereas secondary skin disease means a primary skin disease is there, such as a immunopathy or a an endocrinopathy, which produces the effect on the skin so that a skin disease is developed. That is a secondary skin disease. Like that, a secondary anorexia also is there. Anorexia is produced due to a primary cause. So actually we have to, in secondary anorexia is, it is very dangerous and should be diagnosed or pinpointed, the cause of secondary anorexia. And the primary reason has to be pinpointed and treated. Quakes, what they know about it? They do not anything in the quakes. So what the quake do? They will simply give some medicine against anorexia. Generally, a client who produces the dog, or they will phone to us, it is having anorexia, it is not eating anything, suggest some medicine. They know only about the anorexia. It could be a primary or a secondary anorexia, which we should rule it out. So it's occurring due to a primary reason. So first of all, we should have to differentiate a true anorexia, whether there is anorexia or a pseudo anorexia. Yes, see, if it is pseudo-anorexia means the patient doesn't have that much of anorexia. It will smell and then go back. That is pseudo-anorexia. There will be having certain solid reasons. For that, to differentiate whether it is a pseudo-anorexia or a true anorexia, there should be a pain on prehension, grabbing, prehension. There should be pain because sometimes it cannot open its mouth, sometimes it cannot close its mouth. Prehension, mastication, and swallowing due to painful diseases. What the pain may be here only, localized lesions. Like it could be a tooth root abscess. Tooth root abscess is especially on the infraorbital area. It is commonly found in dogs. I will show the picture. Tooth root abscesses. Periodontal diseases. It is extremely common in dogs where it will be having pain. It cannot chew anything. So that due to pain, it will be having a pseudo anorexia. Then there may be gingivitis, inflammation of the gum due to so many reasons. Maybe ulcerated gingival complex. Maybe then due to renal diseases. Maybe due to trauma of the gingiva. Ulcers may develop. Gingivitis may develop. Buccal ulcers may develop. All the same reasons of gingivitis, like renal disease, or whenever there is gingivitis or buccal ulcers, it is mandatory that you should go for the renal function test. Okay. Then foreign bodies inside the mouth. Generally, it produces pseudo anorexia, but there will be obviously noticing clinical signs such as scratching the area, scratching the cheeks, scratching the neck, etc. Then maxillary or mandibular fractures. It is too painful. It cannot grab or it cannot prehend anything. So there will be pseudo anorexia. Don't think that it is anorexia, but there is difficulty in grabbing or prehending the food. Temporomandibular junction luxations, dislocations, pain on the temporomandibular joint, etc. This is the area of temporomandibular joint. And due to that, there will be difficulty in opening the mouth. So this is a gliding joint. Sorry, it is a ball and socket joint, and in this ball and socket joint, it cannot move that temporomandibular due to temporomandibular dislocation or luxation. It will be painful, and due to mandibular paralysis, the muscles of the mandibles, they are being innervated by the mainly the trigeminal nerve. So when there is trigeminal nerve paralysis, such as idiopathic trigeminal neuropathy, ITN. ITN is also idiopathic trigeminal neuropathy is somewhat a common disease of dogs to a certain extent. In such conditions, it cannot prehend. So it produces a pseudo anorexia. Then temporal muscle myositis or masticatory myositis. It's also not very common, but it can happen. I have seen cases of masticatory myositis. When the animal is not able to chew anything or prehend anything, it cannot open its mouth like that. Sometimes when it is opened, you can see that jaw will be hanging down. So when there is a mandibular paralysis or a masticatory myositis suspected, you have to be beware of rabies also. Always you should be very cautious. The first preference should be given to rabies. Then only the next diseases. Like it could be the tetanus. In tetanus, though tetanus, I have found so many tetanus in my lifetime in dogs, but tetanus always, it produces stiffness of the or violent contraction of the masticatory muscles and locked jaw, or spasms of the muscles of mastication producing locked jaw. So it cannot prehend. It is a pseudo anorexia. So first of all, we have to find out whether it is a true anorexia or a pseudo anorexia. These A, B, C, and D are the causes for pseudo anorexia. Then other causes of anorexia could be tonsillitis. The tonsils can be examined in the dog. Of course, if it is a pug, it is very easy. Simply open, you can see, pull out the tongue. It could be very easy sometimes because it is brachycephalic. Some other brachycephalic dogs are also there, like the Rottweiler. But imagine opening the mouth of a Rottweiler, a biting, aggressive, ferocious Rottweiler. Very difficult. And also, it may be your last opening of the mouth. So, to examine the tonsils are located at the opening of oropharynx. You can see the tonsillar crypts, elongated tonsillar crypts. Inside you can see the elongated tonsils. Normally, it will be having a color almost equivalent to the soft palate mucosa. But when it inflames, it will swell up due to the inflammation. It will be cherry red and popping out. We can see it well. So it won't eat anything because of pain, odynophagia. So in such conditions, you can open the mouth and then determine. But opening the mouth of a Rottweiler like this is very difficult, impossible. But examining the tonsils in such an animal will become more easy. Put him inside the cage, irritate him so that he will continuously open the mouth and bark at you. Okay, it is barking at you. By the time you go near it and take the video, so that in the video you expand it. Okay, magnify and take the video from inside the mouth. Before that, you light a torch, and then in good light you take the video. Take the video camera, rewind it and see. You put it in slow motion and see. Well, you can clearly see the tonsils of that biting Rottweiler, ferocious Rottweiler. Also, you can see the pharynx for pharyngitis. Otherwise, we may not be able to look the pharynx and tonsils, the oropharynx, etc. always. Because we know not only Rottweilers, Dobermans, German Shepherds, etc. are very dangerous. Then, dogs with esophagitis. As we know, the esophagus of the dog is wedge-shaped. The upper area or the anterior area is wide and the posterior area is narrowed. So that the esophagus, when it is gulping something, it will immediately go to the down at the end esophagus, go to the area of the gastroesophageal sphincter. And then what will happen? There will be irritation of that area. Sometimes sharp bone particles, etc. are there. See, during swallowing, if it is swallowing ordinary food, if it is fed with the dry food, sometimes the dry food itself will irritate the pharyngeal mucosa producing pharyngitis. Or if it is fed with the chicken bones before crushing or after crushing it may form sharp pieces and will produce cracks and fissures on the pharynx and the esophagus where it is going. Can produce traumatic pharyngitis and esophagitis. Will produce an anorexia. So also it will dump into the esophagus at the region of the gastroesophageal sphincter. So then the gastroesophageal sphincter will relax. It will be pushed out into the cardia. While it is being pushed out, it may traumatize the sphincter also, producing esophagitis. Typically, there will be some regurgitation, or it will smell and then goes on. Sometimes there will be slight salivation. In gastritis, inflammation of stomach itself, maybe a fundic gastritis or a pyloric gastritis, whatever it be. There will be complete stoppage of eating. Why? Because the body is giving absolute rest to the gastric mucosa. Gastritis may be gastroduodenitis or gastroenteritis. So the whole alimentary canal will be given rest by anorexia. Vomiting and diarrhea. Okay, that is again substantiable. Complete rest to the alimentary canal. And so appetite center will be depressed and no food at all. Inflammation of accessory digestive organs like the liver and pancreas. Of course, if the liver is inflamed as hepatitis or pancreatitis, the whole digestive disturbance will be there. The animal will go anorectic. It is, you know very well. Gastric ulcers and gastroduodenal ulcers, absolute rest should be there. Otherwise, this will not heal. Then, infectious and non-infectious conditions of the large and small bowels. In all these conditions, the same thing can happen. It is for the rest of the gastrointestinal tract. Maybe a twist or a block. Twist means it could be intestinal torsion, or block like intestinal obstruction, or telescoping such as intussusception. All these things can cause complete blockage of food intake. It is only a natural body mechanism by which the intestines are allowed to heal by its own. So anorexia is only a clinical sign. We have to take into account the associated signs to rule out the primary causes. Cancers also can cause anorexia. We all know it. Certain chemical mediators released by cancer cells, they can depress the appetite center, producing anorexia. In alimentary canal disease, as when it occurs, anorexia will be immediately shown. That we know very well. Anorexia will be shown very early in alimentary canal diseases, but anorexia is generally shown as a late symptom in cancers. That also we know very well. In renal diseases, kidney diseases, anorexia generally is shown in the terminal conditions. So we know what happens in renal diseases. There will be electrolyte imbalance, that is the main thing, like hyperkalemia, hyponatremia, hypernatremia, etc. That I have dealt with in fluid therapy. Then anorexia of non-GI causes. Anorexia are there non-GI causes. That we are coming into detail. We will come into detail. You know the tooth root abscess. It is well evident from outside itself. Sometimes a carnassial teeth or a tooth root abscess can produce this type of a swelling over the infraorbital area. The animal won't eat anything at all. See, in periodontal diseases, so you can see the teeth, complete tartar and plaques, having severe periodontal disease. This has to be scaled. Otherwise, the animal will be reluctant to eat much. These are all producing pseudo-anorexia. Because it has appetite, but it cannot eat due to the periodontal disease and pain. See, another case of periodontal disease. You can see the plaques. This has to be scaled. Then only appetite will be regained. See the gingivitis. Here you can see the buccal mucosa. The gum mucosa is completely edematous, inflamed, red in color. So it will be highly painful. It cannot prehend or masticate any food. There also you can see the plaques. And this gingivitis has formed due to this periodontitis. There is periodontitis with gingivitis. This produces pseudo-anorexia. Is it having true anorexia? No. It is having pseudo-anorexia only. See the buccal ulcers. Buccal ulcers can be seen. Whenever you see gingivitis or buccal ulcers, we have to check the kidney function. Now this cannot eat because of the extensive buccal ulcers. See the buccal ulcers, the bleeding buccal ulcers can be seen. Definitely this animal will not eat. It will be having pseudo-anorexia. See the buccal ulcers with a mild periodontitis and gingival edema. See the buccal ulcers, extensive buccal ulcers and the gingivitis, mild gingivitis. So all these things can produce pseudo-anorexia. Sometimes pain from fractures of the bones of the skull can produce. We know the bones of the skull like the frontal bones, the facial bones, the nasal bones, and the mandibles. The frontal bones, we know the occipital bone, the temporal bone, the frontal bones. This is the cranial bones. The cranial bones, the facial bones, the nasal bones, and the mandible. See, coming to the cranial bones, their fracture will not produce any anorexia generally. But regarding the facial bone, if it is a fracture of the facial bone, there will be pain on prehension and produces anorexia. That is pseudo-anorexia. Then the nasal bones, they also show pain, especially when there is a fracture of the mandibles. It cannot prehend, so there will be pseudo-anorexia. In cases you have mandibular paralysis, always in this dog, there is mandibular paralysis. It could be idiopathic trigeminal neuropathy. Sometimes, always the first choice should be given to rabies in such cases. Mostly drooling will be there in mandibular paralysis or rabies or idiopathic trigeminal neuropathy or masticatory myositis. So in this condition, the animal will be having, in mandibular paralysis, the animal will be having pseudo-anorexia. This is tonsillitis. You can see the heavily inflamed tonsils, enlarged tonsils peeping out of the tonsillar crypts, which produces dysphagia, odynophagia. Dysphagia and odynophagia, and in such case, there will be painful deglutition producing anorexia, but it is a pseudo-anorexia. It is a case of masticatory myositis. In masticatory myositis also, see, in this condition also you should suspect rabies, because in masticatory myositis and concomitantly sometimes there may be trigeminal paralysis or hypoglossal paralysis producing protruding of the tongue. All these cases has to be related first to rabies. So in this case also it cannot prevent masticatory myositis. Then we have mentioned about the non-GI diseases. In urinary tract infections, yes, in acute UTI, it will refuse food. It is a non-GI disease which can produce anorexia. Urolithiasis, there will be pain, dysuria and stranguria. The animal will be concentrating completely on the urinary obstruction. It won't eat any food. Pyometra, we know whether it is an open pyometra or a closed pyometra. If it is an acute pyometra, animal will refuse food. That's why we are giving IV fluids. In peritonitis, following an abdominal wall puncture or sometimes following a surgery, abdominal surgery, peritonitis is not common in dogs, but infectious peritonitis can be seen as a disease in felines. FIP is a feline infectious peritonitis, can produce anorexia. Acute respiratory diseases such as severe rhinotracheitis, canal cough in the animal, odynophagia, pneumonia, bronchopneumonia, pleuropneumonia. If it is in the acute stages, animal will refuse food intake. So also pleuresis, severe pleurisy, severe pericarditis, the animal may refuse food intake. Then diffused deep pyoderma. As I said in dermatology, the most dangerous form of pyoderma, diffuse deep pyoderma. There will be a systemic involvement, and so anorexia occurs. That is true anorexia occurs. It's not pseudo anorexia. That's a non-GI cause for anorexia. Fractures, dislocations, muscle injuries, pain, etc. on the limbs, limb bones. All these things produces pain, and then there will be anorexia. Hernia, here a normal hernia. You see, umbilical hernia is very common in dogs, non-strangulating type of umbilical hernias. It doesn't produce any issue to the dog. But when there is a inguinal enterocele or a mesenterocele, and when there is a strangulation pain, animal refuses food. So the cause of anorexia in that animal is hernia, the irreducible type of strangulating type of mesenteroenterocele. That is according to severity of the hernia. Then post-surgical inflammations during a very extensive laparotomy, internal fixation of the femur. So these are all very major surgeries where the animal refuses food at all. We have to give supportive therapies after that surgery. The cancers, developing cancers, whatever be the cancer. I've met with the case of a Doberman. It is written in my textbook also. A Doberman which is having anorexia for almost 18 days. And the treatment was going on with antibiotics for the last 18 days. No improvement with antibiotics and IV fluids. It came to me and I noted that it was done by a very popular doctor, and I had to do something else because he has given already all the possible treatments. Upon clinical examination, it had ascites, but I have to examine the abdominal cavity. So for examining the abdominal cavity, I gave Lasix injection, furosemide in a very heavy dose. And next day I palpated the abdomen. I found severe hepatic and splenomegaly. All the lymph nodes were highly enlarged, even the subiliac, mesenteric lymph nodes, etc. Then I took FNA from the lymph nodes, FNA from the bone marrow, not the FNA, bone marrow aspirate, FNA from the mesenteric lymph nodes and also the peripheral lymph nodes. Took the blood smear, stained everything in paprikolo, and with the help of a human pathologist, we diagnosed that it was acute lymphoblastic leukemia. It was acute lymphoblastic leukemia. And so the cause of anorexia was this cancer, acute lymphoblastic leukemia. How will you investigate anorexia? So anorexia is there. You now know that there is anorexia, true anorexia, and sometimes you know that it is pseudo anorexia. How will you investigate anorexia? So the main objective in investigation is to find out the underlying cause of anorexia. That is a Herculean task sometimes. So the investigations, whatever you are doing, should be substantiating, logical, cost effective, and necessary only. Don't beat around the bush. That is what I mean. It should be substantiating. Suppose you want to know the liver function test. Why? Why you should substantiate? Because I found that there is moderate hepatomegaly. There is oliguria, proteinuria. The urine is having froth when it is passing the urine. Suspect proteinuria. Take the urine, go for the protein test. Okay, I am substantiating it. Why I am doing this? So also I am substantiating it by doing a renal function test. Animal is having too much of gasping, exercise intolerance also. I will take the blood and send it for T4 analysis. Thereby I am substantiating it. The animal will be having peripheral edemas, subcutaneous forelimb edema, hindlimb edema. Suspect right side heart failure. Of course, good. I am going to take the ECG then. So everything should be substantiable. That is why I say it should be cost effective. Don't beat around the bush and do all the test irrelevant things. Don't do all these things unnecessarily wasting the money of the client. Don't do all these things. Do according to the need or our findings. Anamnesis is the first step in the investigation. Go on questioning the master or the owner of animal. When the animal's owner speaks out, we will get lot of clues. For example, he may say that the animal is always dragging the anus through the floor. Of course, it is a clue that there could be cystidiasis or there could be proctitis. Okay, then confirming the cystidiasis, you can take the fecal sample, go for the fecal sample test. Upon smear examination, you can see the egg packet. Okay, you can say that it is Dipylidium caninum. It is lying flat on the wet floor always. It is having vomiting also with anorexia. It's a clear indication that there is gastritis. So certain things we can get from the anamnesis. You question the owner of the animal. So while anamnesis, simply for the sake of asking anything, don't ask. Ask only certain things. What is the duration of illness? It's important. It had been anorectic for 4 days. Anorectic since only yesterday. All these things. This is very important. Duration of illness. Is it accompanied by weight loss? Is it accompanied by weight loss? If yes, if it is accompanied by weight loss, it reflects the degree of chronicity. It's chronic in nature. If the anorexia is chronic in nature, there is weight loss. If it is anorexic since yesterday, there is no weight loss. Okay. Is there any change to less palatable diet? Had you any change in the diet to less palatable one? No. Then we can eliminate that thing. Question it. How much amount of food you are giving? What is the frequency of your feeding? You can ask the client. What is the breed? Certain breeds will be nervous, such as small breeds will be highly nervous. So such breeds, when become more, there will be anorexia nervosa. So that thing we can rule it out. So what do you think? Ask the owner, what do you think? It is having appetite, doctor. It is going and smelling it, but after smelling, it will go away. I think there is something problem with the mouth. It cannot eat or chew. It cannot grab it. Okay, that is a clear indication that it is a pseudo anorexia. So you can check the oral cavity, the facial bones, the mandibles. Any other clinical signs associated with anorexia, such as oligodipsia, polydipsia, vomiting, diarrhea, abdominal pain, grunting, all these clinical signs. Is there any change in the animal's routine or environment? Like he was not there, he went to Delhi for 1 week, and by that time it went anorectic because the change in the animal's routine is changed. He had been taken for walking every day, but now it is not there. So all these things has to be asked and nothing more. Then the causes of primary anorexia could be the neurological dysfunction, like appetite center is destroyed due to a tumor. An increased intracranial pressure will be pressurizing the appetite center, producing destruction. Altered smell or taste sensation due to the neurological dysfunction. So these are three other neurological dysfunctions. Psychological factors, sudden change in the diet to a less palatable one. Change in the environment will definitely produce anorexia. Altered daily routine, excitement, anxiety, fear, stress, everything we have discussed. These are the causes of primary anorexia. Then coming to the causes of secondary anorexia, fever of any origin. Yes, in fever, it will go anorectic. We all know. Pain, especially when there is severe abdominal pain. Toxins or drugs. Certain drugs, for example, cabergoline, will depress the appetite center. That is why it is said that cabergoline should be given in exact doses. The dose is 2.5 to 5 microgram per kg, not more than 5 microgram per kg. So the dose has to be maintained. That's very important. Then bacterial endotoxins produced during pyometra. Then endogenous toxins produced in uremia, renal dysfunctions, hepatic dysfunctions, diabetic ketoacidosis. Ketone bodies will be produced in excess. In hepatic failures, toxins will be producing toxemia. Or we say that hepatic encephalopathy produces anorexia. uremic encephalopathy produces anorexia. All these are endogenous toxins. Exogenous toxins which are being consumed from outside, maybe a rat poison, or maybe amitraz consumed, leaking the cypermethrin, etc., can produce anorexia. Infectious diseases, any disease like a primary GI disease or a non-GI disease, etc., we have mentioned all these things, can produce anorexia. Any inflammation or neoplasia of abdominal visceral organs, such as a splenic neoplasm, splenic tumor, renal tumor, tumors in the intestine, mesothelioma of the peritoneum, hepatic enlargements, hepatic tumors, lymphosarcomas, all these are inflammations and neoplasia of the visceral organs which can produce anorexia. Distension of the stomach. For example, in severe ascites, due to the pressure inside the stomach, the pressure receptors will give the negative inhibition, producing anorexia, or distension of the stomach or small intestine. Uterine distension, as in the case of pyometra or mucometra, can produce anorexia by the stretching of the walls of this tubular organ. Endocrine or metabolic diseases in dogs, such as hypothyroidism, yes. In hypothyroidism, due to reduced T4, lethargy, etc., will produce anorexia. In hypoadrenocorticism, it will be having anorexia and severe vomiting. In hypercalcemia, it will be having anorexia. Then very important in cat is hepatic lipidosis. Dogs can go anoretic for 4 or 5 days. Nothing will happen. But in the cats, not more than 48 hours. If it goes anoretic more than 48 hours, it can produce a very fatal hepatic lipidosis in the cat. Severe fatty infiltration and produces even death in cats. High environmental temperatures can produce anorexia. Then miscellaneous disorders such as cardiac failure produces cachexia, cardiac cachexia. Yes. A chronic cardiac failure can produce anoxia or hypoxia to the skeletal muscles, producing wasting of skeletal muscles, and there will be cardiac cachexia. Motion sickness or inner ear disturbances, etc., can lead to anorexia. It is very common in dogs. How will you examine the dog for anorexia? We have all the 6 methods, eliminate the 2 methods. We have the inspection, palpation, percussion, auscultation. Do it. Before touching the animal, go for inspection, or touch the animal and see the palpation, different areas of palpation. We can physically examine either a complete general systematic clinical examination or a complete examination, a quick examination from the nose, tip of the nose to the tip of the tail. This is according to the Merck manual. So it contains inspection, palpation, auscultation, percussion. That doesn't mean that you should auscultate the tail. Relevant examination should be done on relevant organ. So consider that anorexia or hyporexia is a clinical sign of almost all diseases except a very few producing polyphagia. Polyphagia is entirely a different thing. Except very few means in Cushing syndrome, in According to our timings, we are making a general clinical examination either through a thorough systemic clinical examination or by examination from the tip of the nose to the tip of the tail. Always you should look for additional clinical signs. Then, whenever it is being produced to your clinic, weigh the animal. Daily weigh the animal so that you will get the body weight. If there is a reduction in body weight, a progressive body weight and fever always indicates systemic illness. If there is a progressive body weight with fever, it's a systemic illness. Rule out the conditions interfering with the prehension, chewing, swallowing, etc. Food may be offered to confirm in front of the owner or on the table itself. We can offer some food and we can confirm that it is anorexia. It is true anorexia or pseudo anorexia. Check the oral cavity for pain in opening the mouth, teeth root abscess, periodontal diseases, fractured teeth, stomatitis, gingivitis, glossitis, tongue ulcerations and foreign bodies. All these things can be done. Check the bones of the face and mandible for fractures or dislocations. Check the muscles of mastication for pain, swelling over the temporal muscles. The investigation plan. How will you investigate anorexia? There should be a full routine hematology. That is very important. A full routine hematology should contain TCDC, TLC, TRBC, hemoglobin, PCT, then PCV, hematocrit, MCV, MCHC, MCH, all these things. A full hematology. Then a complete blood biochemistry. If at all I am saying complete blood chemistry, biochemistry, don't go for all the things because it is not gunshot. It has to be done only according to the need. In hepatomegaly, go for hepatic dysfunction, go for liver function test, then go for urine biochemistry, radiographs of the thorax and abdomen, so that you can get lot of things, study lot of things. Then feline leukemia virus and feline infectious virus screening in cat. It is not that it is all taken from a textbook and that is only thing I have written it. But don't worry about all these things. Additional tests can be done based on the history, clinical findings, and results of the preliminary test. If you have hyperglycemia, okay, then go for a pancreatic dysfunction. So that's it could be a necrotic pancreatitis. These are the complications of prolonged anorexia in dogs and cats. Hypoglycemia, hypokalemia, hyponatremia, hypomagnesemia, dehydration, acid-base disturbances, acidosis will occur, weakness, hypotension. See, we have to take into account, this is very important. These are the things we have to keep in mind when dealing with or we are managing anorexia. These are the complications. Then how will you manage anorexia? A symptomatic therapy employed if the cause cannot be ruled out. There is no clinical or laboratory evidences. Improve the either or. So symptomatic therapy, if you are not able to find out the real cause, go for symptomatic therapy. IV fluids, pantoprazole, antibiotics, go for it. Let us see what is happening. Or for increasing the appetite, you can add certain order like a tuna, sardines, chicken gravy from pedigree, etc. Add to it. B complex vitamins either orally. If it is not taking orally, okay, then B complex vitamin injections. But in the cat, oral diazepam, and it is proven. Diazepam is the best in cat orally at 0.25 milligram per kg orally OD. That is the best anti-anoretic for the cat. So also the dog also can be used as an anti-anoretic. So many drugs are there. Proprietary Ayurvedic medicine such as leaf 52 from Himalaya is there. Or we can go for other drugs such as cyproheptadine, etc. can be used. Then dehydration, electrolytes, acid-base imbalance, etc. should be corrected. And with that, I am winding up this session, and I hope you might have achieved so many things from this short lecture. Thank you, my dear friends. Thank you very much for patiently listening to this webinar. And I am coming with very beautiful webinars again and again. And please wait for that. On 6th, I am coming with the next webinar, that is vector-borne diseases and its field level management in dogs. It's on 6th. It's coming, doctors. Thank you very much for joining. Thank you very much. Have a very nice day. Bharat Mata Ki Jai. Thank you. And now our topic is open for discussion. Thank you very much. So I will start from the top. Let me start from the top. How can we differentiate between mandibular paralysis and masticatory myositis? In mandibular paralysis, that is written by Dr. Mary Lishi, and mandibular paralysis, there won't be any pain at all. But you can see that the mandible is hanging down. So that is how we do. In masticatory myositis, there will be severe pain of the muscle, masticatory muscle such as the temporalis. So we can differentiate it very well by clinical examination itself. That is mandibular paralysis and masticatory myositis. From rabies means, see, in rabies there will be too much of drooling of saliva, and we'll be having imaginary fly-catching behavior, pawing of the ground, retching, vomiting, paralysis of the hindquarters, ataxia, staggering gait, progressive paralysis of the hind limbs, etc. And then there will be a history of a dog bite. Tell more about myositis. Tell treatment of gingivitis. Gingivitis, the treatment is, see, in gingivitis, the animal will completely be anorectic, and invariably IV fluid therapy is a must, going with antibiotics, and you can use metronidazole gel over the gingiva, inflamed gingiva, the gum. Tell about myositis. Myositis is almost self-limiting, but I used to give this flunixin meglumine. Good. Treatment of ITN, that is idiopathic trigeminal neuropathy. That is actually self-limiting, but we can hasten the healing process by giving 1 or 2 shots of corticosteroids. Treatment of gingival and buccal ulcers. Yes. In application, yes, metronidazole gel can be applied. Metronidazole gel. That is the only thing which can be applied. How to, Dr. Surya, how to choose Toxol? What is Toxol? I don't know, doctor. Toxol. Tribuvate, okay, that is B complex. Lev52, yes, Lev52. I'm not, Dr. Nikita, if I talk about Lev52 means I will become an ambassador of Himalaya. But Lev52, it contains a lot of appetite stimulants. It is a very good appetite stimulant. I have a lot of the product in my hospital. A dog taking food in the evening with egg very nicely, but in the morning pseudo anorexia. See, that is only choosy feeding, Dr. Shyam. Role of pantoprazole, definitely. Pantoprazole, it is an acid secreting inhibitor. It's a proton pump inhibitor by which, see, the H plus and chloride minus, they will conjugate in presence of a proton bombarding. This proton bombarding can be inhibited by these inhibitors like pantoprazole, rabiprazole, omeprazole, lansoprazole, etc. So pantoprazole is excellent in that condition, so that hydrochloric acid will not be formed. Ascites in Canada. Dr. Gaurav, ascites is a very big another topic that itself takes almost more than half an hour, because I have tell lot how to manage ascites. Management of ascites is definitely finding ascites is only a clinical sign. We have to find out the cause of ascites, then treat the ascites. As you go through my textbook, it has 6 issues. Ascites may be nephrogenic, cardiogenic, hepatogenic, hematogenic, cancers, or miscellaneous. All these things I have written in detail in my textbook. Odynophagia and dystonia. Dystonia is actually a word used in medical science to produce weakness of the muscles. But in veterinary science, in diagnostic pathologies, we use this dystonia as a painful bark, not oh, oh, it will be like this, a painful bark due to the inflammation of the laryngopharynx, vocal cords, etc. Odynophagia means there is pain on deglutition, pain on swallowing. Focus starter slowly. GST puppy 40 days, 45 days old feed change to a royal can to drool. Focus starter slowly, but diarrhea seems possible. Yes, this can happen. Only it's a 1.5 months age small pup. It can happen. You slowly change only. So by this time you have to give a hepatic or a digestion corrective. Like you can go for, see, my best choice is Digiton Plus. Dog is eating but not efficacious since 3 days. Dr. Pankaj Kumar, what I can tell, we have to find it out. For the 3 days only means it could be something related to the feed or to the food only, the diet only. May not be having that much of fiber. That may be the reason. Can you discuss 2 cases of anorexia? Sir, I already mentioned that I have, with these 2 hands, I have handled more than 4.9 lakhs of clinical cases, nearly 5 lakh clinical cases. Oh, in almost all those cases, I have handled anorexia. Anorexia is a commonest clinical sign. See, diazepam, there is no textbook which says, mechanism of action is there, but in our clinical medicine textbooks, it is nothing being said. It is said that diazepam increases the appetite in dogs. I don't know, but I've seen that diazepam increases the appetite. Management of tartar other than scaling. We can give chews. Chews are there for dog, but scaling is the best one. Without scaling, I cannot say that you can deal with tartars. Meglumine, you can go for 0.5 to 1 milligram per kg. Yes, production can be given to the dog. Dose of leaf 52, then according to the company says it is 1 teaspoon TAD, 2 teaspoon TAD, 4 teaspoon TAD, that according to the body weight, etc. 48 hours we get. Anorexia problem. Yes, anorexia is a big problem in cats, produces hepatic lipidosis. Better not to use cyproheptadine in the cat, we can go for Digiton or other preparations. Better not to use cyproheptadine in the cat. Book, I will tell Dr. Vijay Umar. Waggle maneuver, it is said so, but we never had. I used to do waggle maneuver only in cases where we have a sinus tachycardia. And my dear friends, now we are winding it up. And in this session, so I should thank you very much for having come over to my sessions. And our next session is much more important and highly relevant. You please join this session also, our VBDs, vector-borne diseases, the commonest vector-borne disease in dogs and their field level management. It is coming, Dr. Saab, and be prepared on 6th. It is coming, and by tomorrow we are going to publish that brochure for it, and we will meet on 6th. So thank you very much. Thank you. Jai Hind. Bharat Mata ki Jai. Thank you.